Alert now with concerns of a triple-demic looming. A pediatrician at Monroe Carroll Jr. Children's Hospital says doctors are already seeing very high levels of RSV and the flu. News 2's Kendall Ashman is live at the hospital tonight. And Kendall, should parents be worried?
Well, Alex, Dr. Antone says parents should be proactive because he says right now there is a high number of children hospitalized with RSV.
I cannot stress enough that this is not going to be a normal winter.
Monroe Carroll Jr. Children's Hospital pediatrician James Antone says RSV cases are on a steep rise.
I know our percent positivity is about 20%, which is higher than the national average. And I can just say anecdotally, when I was on clinical service last week, almost half of the patients I had in the hospital had RSV.
But he says the uptick is a national trend.
And we're on this really steep rise right here early in the season.
On top of RSV concerns, he says Tennessee has one of the highest rates of flu cases in the country.
This is the highest number of cases of flu during this time than we've seen since the 2009 H1N1 pandemic, and that has a lot of doctors concerned that we're going to have a triple-demic of RSV, flu, and COVID at the same time.
But he says there's a clear reason to why we are seeing a surge. Cases of RSV and other respiratory viruses were down during the pandemic.
And because of that, the seasonality of our viruses has been thrown off. Last year, we saw a never before seen RSV surge in the summer, and now we have this early winter surge of both RSV and flu.
He says one of the biggest challenges for parents is differentiating between the three viruses, as all have similar symptoms.
And there's no way to distinguish based on symptoms alone between those three viruses. The only way to know is to get tested, but we typically only test those who have severe symptoms of RSV.
So Dr. Antone says it's extra important to get your kiddos vaccinated for the flu and for COVID since there is no vaccine for RSV, which tends to be worse for kiddos under 5 and adults over 65. Mark.